So what is COPD? So it's chronic obstructive pulmonary disease, and it's a disease that gradually destroys your lungs, especially if you smoke, is one of the main cause. So the tobacco affects your airways and your ear sacs, and usually we see that more. It's a disease that progresses, and if you do smoke, that's one of the main cause that does affect your lungs, so your bronchioles, your airways, and your ear sacs. And a prolonged time of tobacco usually comes to chronic obstructive lung disease. Other less factors could be exposure to certain irritants, exposure also to pollutants. We also see certain rare disease that are genetic that become COPD. Also, we know that an asthmatic that never been well diagnosed or that is not well controlled can become COPD. So COPD is a progressive lung disease, and if it was not well maintained, it can become more breathlessness, worsen symptoms, and your endurance and activity level will be very affected, to the point that if it progresses even more, you can have respiratory failure. And if that doesn't being addressed, it could be also to death. So since COPD is a chronic disease, so what is the symptoms we usually see? So a chronic cough, wheezing, chest tightness, producing of a phlegm, and shortness of breath, and your activity level is reduced. Over time, COPD has a tendency to lead to the point that they have so much symptoms that they have a distress, so respiratory distress. Also have more risk of recurrent lung infection. If you smoke and have COPD symptoms and it gets worse, and you do also have a recurrent lung infection that is between 1 and 2 weeks, it's best to approach a health professional and see if you do have COPD. According to diagnosis of COPD, to be more efficient, you have to have a spirometry, and it's more precise also of the severity of the lung disease you have. And you can have it at your doctor's office or at a pulmonary function test that you see usually in the hospital. So to understand COPD is to be diagnosed, but when you know your diagnosis, it can be overwhelming. So therefore, it's very important to go to a follow-up with your healthcare professional to see what treatments we can go through and options, and then see how we can help you get back to breathing better. This includes lifestyle changes, including quitting smoking, having the right puffers, the inhalers for your condition, and then having a treatment plan or a plan of action when you do get sick. Therapy for the patient includes quitting smoking first, also to make sure they use their puffers correctly and they have the right inhalers, promote activity, physical activity, and they can go to a pulmonary rehab to show them how to breathe properly, and how to manage their symptoms. You see in a pulmonary rehab how to pace yourself, and also your daily activities and how to manage how to support your breathing disease. Also immunization too, so make sure you have your pneumonia shot. Also your COVID shot and your flu shot, so therefore you can prevent some infections. Also, when it comes to treatments of COPD, you also want to make sure that you're avoiding triggers that triggers your lung condition. So any irritants or pollutant will be a thing to be aware of. So the choice of inhalers depends on the severity of your disease, your condition, how you take your puffers. So also you want to know that bronchodilators will open your airways. And then you have other inhalers that are for steroid-free inflammation. So the corticosteroids will be for the inflammation inside your lungs. And sometimes you have a combination of both, or you can have to get a combination of puffers. And if the severity is chronic and therefore you need mini puffers, sometimes we can combine those 3 puffers in 1 puffer. So in severe cases, when you see that medication is standard medication can't maintain that disease severity and you do have more flare-up, sorts of subsides of what some COPDers, their option sometimes is supplemental oxygen, or also there's a surgical procedure to help evaluate the non-functional part of the lung, and that will help them breathe a little bit better. While COPD is a chronic disease, there's a step to kind of trying to slow it down. And the 2 most ones is quitting smoking. Even though you have COPD, quitting smoking will help decrease the progression of the lung disease. Also, reduce environmental irritants or pollution, secondhand smoke, or also environmental pollution. That way your lungs are not triggered to have a flare-up. In conclusion, COPD is a progressive lung disease that has many causes, obvious symptoms, and many different various ways to treat it. So early diagnosis for COPD is lifestyle change. Also, listening to the healthcare provider's advice will essentially manage your symptoms of COPD. So remember that prevention is better than treatment when it comes to COPD, so you can take steps to protect your lung health.